Hello and welcome to my channel. This is Isaac Simple. Thank you for tuning to my channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like and share. This is a channel where we shall talk about issues concerning averting HIV and sexually transmitted infection stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. Thank you. Today we'll be starting a new season, and in our new season we'll be discussing about opportunistic infections associated with HIV infection. Thank you. In our first episode, we'll be discussing about tuberculosis infection. And someone may ask, why tuberculosis and why tuberculosis now? Let me take you back to history. Between the year 2000 and the year 2021, 74 million people globally have been diagnosed with tuberculosis infection. In the year 2021 alone, 10.6 million people globally were diagnosed with active tuberculosis infection. And out of the 10.6 million, 1.6 million died out of complication of TB infection. Of the 1.6 million people who died out of the complication, 187,000 people who died out of the complication were co-infected with HIV infection. This makes it very important for us to be able to discuss about tuberculosis infection as an opportunistic infection secondary to HIV infection. Thank you. Tuberculosis is an airborne respiratory disease that is usually caused by an aerobic facultative acid-fast diplococci bacteria that we usually call a Mycobacterium tuberculosis. Are we together up to that point? Thank you. Now, someone may ask, how is this kind of disease spread? Basically, when a person who is actively infected with tuberculosis bacteria coughs, sneezes, or laughs, they usually emit this kind of bacteria in the air. Now, when an immunocompromised and immunocompetent persons inhale this kind of bacteria, the bacteria usually moves to the lungs. As we had said earlier in our definition, this is an aerobic bacteria, which means it entirely depends on oxygen. Now, for the immunocompetent, when this bacteria lands into their lungs, before they get to multiply, they develop antibodies or immunity against this kind of bacteria. And these bacteria are usually inactivated and enclosed in collections that we usually call them gone complexes. When it's one, we usually call it a gonfocus. Now, these persons do not progress to the active TB disease. Rather, this condition whereby bacteria or TB bacteria are inactivated in the lungs, we usually call it latent TB infection. Are we together up to that point? Thank you. Now, for the immunocompromised persons, when they get these bacteria, since they do not have a competent immunity, the bacteria usually multiply and they usually progress to the active TB infection. Are we together up to that point? Thank you. Now, what are the presentation of a person who is suffering from active TB infection? Basically, we usually classify this presentation in a triad. And these persons usually present with a cough, usually a productive cough with a blood-stained sputum. We can also call it hemoptysis. They also present with a significant weight loss that is usually for a period of 1 month. The other presentation is drenching night sweat. This is a situation whereby when you sleep wearing the way I'm wearing or your pajamas, you wake up when they are sticking on your body because you have sweat profusely. Other presentation that are usually general is hotness of the body, pruritic chest pain, nausea. Some people may also develop other general presentations like, let's say, loss of appetite, vomiting, not usually abdominal pain, but it may develop. Are we together up to that point? Thank you. Now, how do we go about the diagnosis? Basically, the diagnosis of tuberculosis is usually by use of sputum. Also, we can do imaging. For the sputum, we can be able to do gene expert. We can also be able to do microscopy. For the imaging, the modality of choice that is the most basic is chest X-ray. Other imaging modalities that we can be able to use to make a diagnosis of tuberculosis, we have CT scan and MRI. Are we together up to that point? Thank you. Now, how do we go about treatment? For the drug-sensitive pulmonary tuberculosis, the treatment is usually for a period of 6 months. Usually, we have the initiating phase and the continuation phase. Usually, it's a multiple therapy kind of treatment, and it's very effective. Now, for the tuberculosis that has progressed to other places like the joints, the bone, and the brain or the spine, the treatment is usually longer. Usually, the treatment takes a period of around 12 months. For the drug-resistant TB, the treatment can take up to 18 months. Are we together up to that point? Thank you. Let's discuss about prevention. Remember, prevention is better than cure. Now, we have different preventive mechanisms that we can use to prevent a person from getting infected with TB disease. To start with, let me start with the simplest: good balanced diet. When you are taking a good balanced diet, you are boosting your immunity so that your immunity can be able to fight these bacteria as they come and to inactivate them in your lungs before they progress to the active TB disease. Are we together up to that point? Thank you. The other thing that we can be able to prevent you from getting this kind of disease is by use of prophylaxis. Persons who usually get encounter with persons with an active TB disease, to start with, healthcare workers are advised to take a prophylaxis of rifampicin and isoniazid for a period of 3 months. These drugs are usually taken on a weekly basis for 12 weeks. They are very effective in the management of latent TB infection. Are we together up to that point? Thank you. The other persons who are eligible to take rifampicin and isoniazid regimen are household contacts of persons who are on active TB disease. They are also eligible and they can also take this kind of treatment for 3 months. We usually call it a TB preventive therapy, usually taken for 3 months on a weekly basis. Now, for the under 5s who are household contacts, they usually do not take this kind of regimen. Rather, they are started of a daily combination of isoniazid and rifampicin for a period of 3 months. For the children or under 5s who are on nevirapine prophylaxis, these are the HIV-exposed infants, they usually take isoniazid only for a period of 6 months. This is because rifampicin usually interact with nevirapine. Are we together up to that point? Thank you. Other preventive mechanism is immunizing your child. Child is usually immunized at birth with BCG. So for those children who are usually delivered at home, please encourage these kind of mothers to take their children immediately they are born to the healthcare facility so that they can be given BCG as a prophylaxis or as an immunization or as a vaccine against TB infection. Are we together up to that point? Thank you. This comes to the end of our discussion today. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like, and share. Thank you, and God bless you. Bye-bye.